Muscle tissue is classified into one of three major categories. Skeletal muscle is the most common. The other two kinds are cardiac and smooth muscle. Skeletal muscle produces purposeful movements of the skeleton. Cardiac muscle forms the myocardium of the heart to pump blood. Smooth muscle provides the motile force for many vital activities, including peristalsis in the gut, emptying of the urinary bladder, pupillary constriction, and childbirth via uterine contraction. Long multinucleated cells called muscle fibers make up skeletal muscles. Each muscle is enveloped by epimysium and subdivided internally into muscle bundles or fascicles by perimysium. Surrounding individual fibers is a delicate endomysium and a thin external lamina, which also encloses satellite cells that closely adhere to the plasma membrane or sarcolemma of fibers. The most striking feature of skeletal muscle fibers is the orderly arrangement of myofilaments into myofibrils with a characteristic striation pattern. Each skeletal muscle fiber is a long cylindrical multinucleated cell. The cytoplasm or sarcoplasm is packed with myofibrils, each with alternating dark or A and light or I bands that cross the fiber from one side to the other. Z bands delineate sarcomeres. Surrounding loose connective tissue is the endomysium. By EM, details of the banding pattern are visible. Mitochondria are found in the peripheral sarcoplasm or in rows between myofibrils. Skeletal muscle fibers are polygonal in cross-section and are close to capillaries and nerve fascicles. With H&E, the sarcoplasm of each fiber is eosinophilic and looks punctate due to tightly packed myofibrils. EM clarifies further details. Myofibrils constitute the bulk of each fiber and mostly contain the major contractile proteins, myosin and actin, which make up the myofilaments. The intervening sarcoplasm contains many other organelles, especially mitochondria. The sarcotubular system is composed of the sarcoplasmic reticulum, or SR, and transverse, or T-tubular system. SR is an elaborate anastomosing network of tubules and cisternae surrounding myofibrils. T-tubules are invaginations of the sarcolemma. At regular intervals relative to sarcomeres, two flattened sacs of the SR, known as terminal cisternae, closely associate with the central T-tubule and form a muscle triad, which is the main site for excitation-contraction coupling. This TEM reveals components of the sarcotubular system. Triads consisting of a T-tubule and a lateral pair of SR cisternae are opposite AI junctions of the sarcomere and near mitochondria. T-tubules rapidly convey electrical impulses from the sarcolemma to the cell interior. The SR, an internal membrane system, stores calcium ions. At the interface of the T-tubule and SR, calcium ions are released from the SR into the sarcoplasm, which initiates contraction. Each sarcomere is delineated by perpendicular Z bands. Longitudinally oriented thick or myosin filaments are in the A band, and thin or actin-containing filaments are in the I band. In the center of each A band is a lighter H zone, bisected by an M line. Interdigitation of thick and thin filaments allows sarcomere contraction, whereby actin filaments slide along myosin filaments. A bands remain unchanged in length, I bands shorten, and H zones are narrowed. Skeletal muscles contain various fiber types specialized for different tasks. Fiber typing via histochemical staining of muscle biopsies has clinical significance for health and disease and is done routinely for diagnosis and treatment. A high percentage of type 1 fibers specialized for endurance are found in postural muscles. Type 2B and type 2A muscle fibers are fast twitch fibers that predominate in high power output muscles. Satellite cells are small, flattened, mononucleated cells located between the sarcolemma of a skeletal muscle fiber and the external lamina. They serve as a population of reserve stem cells for normal postnatal growth or for repair and regeneration of damaged segments of the skeletal muscle fiber after injury. No satellite cells occur in cardiac muscle, so that, in contrast to skeletal muscle, regeneration of cardiac myocytes after injury does not readily occur. Neuromuscular junctions are specialized synaptic sites where a motor axon terminates on the sarcolemma of a skeletal muscle fiber. The axon terminal, with many synaptic vesicles, sits in a shallow depression on the muscle fiber surface. A narrow intervening intercellular space, the synaptic cleft, separates plasma membrane of the axon terminal from sarcolemma of the muscle fiber. The sarcolemma forms post-junctional folds in which lie acetylcholine receptor sites. By TEM, a Schwann cell process is seen as a cap above the axon terminal, which in turn sits on the underlying sarcolemma of the muscle fiber. At higher magnification, many membrane-bounded synaptic vesicles are concentrated near the presynaptic membrane in regions known as active zones. Acetylcholine in vesicles is released by exocytosis into the synaptic cleft, which consists of a primary cleft and several secondary clefts at right angles to it that house nicotinic receptors for acetylcholine. Cardiac muscle is striated involuntary muscle in the myocardium. Cardiac muscle cells, or myocytes, are branched and mononucleated and possess an eosinophilic sarcoplasm with cross striations. Myocytes are organized in a spiral arrangement of layers and are linked by intercalated discs, which appear as dark, jagged, transverse lines between the cells. Of the three kinds of muscle, cardiac muscle is the most richly vascularized, with many capillaries and surrounding connective tissue. Each cardiac myocyte is enveloped by a sarcolemma, which is covered by a thin external lamina. The sarcotubular system consists of the SR and T tubules. Myofilament bundles, or myofibrils, have a regular banding pattern with sarcomeres similar to skeletal muscle. Intercalated discs join cardiac muscle cells where cell borders interdigitate. Discs are aggregates of desmosomes, fascia adherens, and gap junctions. Many large mitochondria occupy a significant volume in the sarcoplasm. In longitudinal section, the regular repeating arrays of myofibrils and mitochondria of cardiac myocytes is revealed. The sarcomere banding is consistent with the sliding filament mechanism that causes contraction. Mitochondria make up 20 to 25% of the volume of each cell. Adjacent cells are joined by intercalated discs. In transverse section on the right, the orderly arrangement of thick and thin filaments is seen at A and I band levels, with large mitochondria and SR between the myofibrils. Purkinje fibers, which are modified cardiac myocytes, are scattered along the innermost part of the myocardium adjacent to the endocardium. Part of the cardiac conduction system, these cells are specialized for conduction of electrical impulses. Their glycogen content is greater than that of ordinary cardiac myocytes, so special stains are often used to positively identify them. Some life-threatening ventricular arrhythmias are initiated by Purkinje fibers. Smooth muscle is involuntary and lacks striations. It's found in walls of hollow tubes, sacs, and internal viscera. It regulates the luminal caliber of many hollow organs, and in blood vessel walls it is known as vascular smooth muscle. Its elongated mononucleated cells have relatively homogeneous cytoplasm. Smooth muscle cells are organized either as sheets or as aggregated bundles oriented in different directions. They have a much smaller diameter than skeletal muscle fibers. This schematic shows components of smooth muscle cells. Thick myosin filaments run parallel with thin actin filaments. Dense bodies link thin and intermediate filaments to the cell membrane. Caveolae are invaginations of the sarcolemma. During contraction, thick filaments interact with thin filaments, and intermediate filaments serve a cytoskeletal role. Each cell has a single nucleus in its widest part. Unlike skeletal muscle fibers, smooth muscle cells have a different, less complex innervation. Unmyelinated, vesicle-containing axonal varicosities of the autonomic nervous system come into close contact with the sarcolemma of a smooth muscle cell. There are no post-junctional specializations. Abnormalities of smooth muscle are major causes of diseases such as asthma, atherosclerosis, and hypertension. This concludes the overview of Chapter 4, Muscle Tissue. Thank you for watching.